Quality of life is all about your health. That's the most important thing that we have.
The health in Jacksonville isn't what it should be, which also means it isn't what it can be. The health barriers in Jacksonville are, in most cases, related to the social determinants of health.
Not having access, secure food, physical activity, those are important issues.
One great thing about Jacksonville is there are so many nonprofits here. There are a lot of clinicians and hospitals. What we really are just working on doing is bringing them all together so that we can work on the same cause.
Where we are currently standing at the food bank, we could literally go any direction and we will hit a food desert. We believe that our food distribution has to be in tandem with critical partners that are like-minded so that we can begin to make an impact in Jacksonville.
The Diabetes Subcommittee, we have a very close relationship with Feeding Northeast Florida. We formed a best practice programming, wrapping services around food insecure diabetics. We want to really make that food healthier and then wrap around that education that's so important. We can begin with a pilot and then expand the program throughout different populations.
This is the Jim Fortuna Senior Center. This is one of the 20 senior centers that are offered in the city of Jacksonville. And this morning we have seniors that have come out to go for walks on some of our beautiful nature trails around the park. Mental health is a big component of what we do. Our mission is to increase the social educational wellness programs. By being able to collaborate with other systems, with other agencies, with other community partners, it increases our ability to get the entire community more active, to walk more, to eat better, to live healthier.
We're on a journey to be #1 ranked on health outcomes of all of the 67 counties of the state of Florida.
The critical thing about Bold Goal is collaboration. There's no one organization, site, person that can help one person become healthy.
Now you see organizations like MCCI working together with the local universities, working together with the health department, working together with organizations like Feeding Northeast Florida.
We can impact mental health, we can impact diabetes. We're all going to have to be working together, collaborating together.
Making the community 20% healthier by 2020 with the help of Humana and all of our community partners. I'm certain we're going to make that happen. We look forward to meeting that and exceeding that, quite frankly.
And that is Humana's Bold Goal. Good morning. I'm Rockman Johnson. Since we are in Florida, let me say buenos dias, ¿qué tal? Bonjour, or ça passe in Creole. And of course, since I am from Jacksonville, Florida, and here representing Edward Waters College, good morning. And Duval. First of all, we're so excited to have you here for this first of its kind event with Humana and Edward Waters College. And the bold goal, as you just heard from that amazing video, was that we want to make sure that our communities are healthier, that they're nourished, and Edward Waters College is a big part of that. So it was exciting for us to partner with Humana. The other thing is that this year has been unprecedented. We knew that there could be possibilities that things could happen in the world, but what we didn't know is how much it would affect people in supply chains. So COVID-19 has been something that has affected us in ways we couldn't have predicted. But the amazing thing is that we've come together to not only help those that are less in need, but to take those things that were highlighted during COVID-19 and smooth them out so they never have to happen again. So to get started today, again, first of all, welcome. Since we can't do this on the campus of Edward Waters College, we wanted to make sure that you are virtually with us, but we'd like to thank you for taking the time to join us. So allow me to welcome you to EWC, even though we're at our homes and offices and around the country and around the world in some cases. But first and foremost, and I'll bring you greetings in just a moment from Edward Waters. But to get us started, I was able to talk to someone who was very passionate about this idea. State Representative Tracy Davis has worked in the Florida legislature and before that in the Supervisor of Elections office, trying to make sure that people's voices are heard. And one of the things that she does that a lot of people don't know is she has a baby shower, so to speak, and does community food giveaways on a regular basis. Of course, when COVID-19 came, she had to step that up, and she did. And they've been feeding literally hundreds of thousands of people, not just in her district, but throughout Northeast Florida. So let's welcome State Representative from Jacksonville here with us today, and a graduate of Edward Waters College. This is Representative Tracy Davis. Welcome.
Good morning. Good morning. Can you hear me, Rockman?
We can hear you well.
Hi, Professor Johnson. How are you doing this morning?
Amazing. Glad to have you with us. Even though we're not together, we are still together.
Thank you. I am so glad Edward Waters has stepped up to put on a panel like this. I'm so encouraged and excited just to be here. But I'll jump right into it. I'm so honored to be here, part of this event as we talk about health and nutrition in our community. Each legislative session and each day I spend in Tallahassee, one of the things is that it's the core of the work that I do, and it's all about access. Even before the ravages of COVID-19, our food insecurity has always been a major threat to people not only in my district, like Professor Johnson said, but throughout the state as a whole. One of the questions I get the most is when I'm out and I'm talking to people is, when are we going to have a grocery store in our neighborhood? And that's a hard question to answer. But with this panel today, I'm encouraged to know that those are conversations that are lending to that direction of having grocery stores available in all neighborhoods. That's why I'm excited about this conversation today. Like this one, we can do so much work to level the playing field. About public and private partnerships working together to ensure that those who may not have as much still have access to what they need, and that fresh fruits, vegetables, and healthy food. Edward Waters College sits in a health zone, actually health zone number 1, although there's certain bright spots like the Shell Sweet Center and the proximity to UF Health, it remains a gap in some of the cases that have cost us lives. Collectively, we have to be willing to not only engage in a dialogue like we are doing today, but to create strong public partnerships, government partnerships to bring the necessary healthcare facilities, community resources, and most importantly, nutrition to our community as a whole. Again, I'm thankful for Edward Waters College and Humana for stepping up to the plate to have what some may see as an uncomfortable but yet necessary conversation about how COVID-19 has highlighted immense deficiencies in our community. However, what is most important is that how we can work together to ensure that those deficiencies are things that are cured and never happen again. Again, I thank you for allowing me the opportunity to be a part of this event, and I look forward to hearing the opportunities and ideas that we can use to strengthen our first class community. Thank you, Professor Johnson, and thank you to the panelists.
Thank you, Representative Davis. We appreciate you. And I know one of your colleagues on the state level from Nikki Fried's office will be coming on soon. So I know you're going to stick around. And again, I can't say it enough. Thank you for the work you do. I know, don't you have an event coming up, food giveaway? Do you mind? Is it too early for us to say something about it?
No. Actually, we are planning, and thank you for that. We're doing a food giveaway, and I'm actually going to, I'm in a conversation today with Dr. Faison to see if we can bring it back to the Edward Waters campus, actually, this time around. And we're thinking of or planning for November 21st.
Gotcha. We will make sure to make note of that. Representative, thank you, and we appreciate you staying involved.
Thank you. Thank you for the opportunity this morning.
And your opportunity to stay involved continues as well. Now, there's a lot of conversation that's going to happen here today, and you're going to get a chance to ask questions. We ask that all you have to do is put your questions in the chat box below on whatever platform you're watching on, YouTube, Facebook, but all around the world. Right now, it looks like there are hundreds of people that are watching this broadcast. So thank you all for tuning in. All we want you to do, though, in order for you to be a part of the conversation, is leave your messages there. We promise we will try to get to every question. And if we can't answer them during the broadcast today, then we will reach out to you via email. And speaking of via email, before we get to our co-host for today, Edward Waters College, I want to just give you a little background. For those that don't know, Edward Waters, founded in 1866, is about access and opportunity. It was a school that was founded by the AME Church, and it allows people who may not otherwise get the opportunity to be educated to have the education that they desire. Doesn't matter race or creed or color or ethnicity or religion, even though the school was founded by the AME Church. But Edward Waters is all about access and opportunity, and it sits in a place in Jacksonville that needs just that. Now, moving forward, I'd like to introduce you to a gentleman I've had a chance to work with over the past few weeks to make this summit a reality. He works directly with Humana, and his title is the Population Health Strategy Lead. But he works tirelessly in this work, not just in Jacksonville, but throughout the community. Please welcome our friend and our hardworking colleague in this thing. And you're no longer just a friend, you're a colleague. You're an Edward Waters colleague now. Please, let's welcome Paul Sepia from Humana. Paul, good day.
Hey, good day. Thank you, Rockman. I really appreciate the time. And thank you, Representative Davis. That's fantastic. I'm glad that you're doing the work that you're doing, and I look forward to working together and coming up with solutions that help to address the needs in the community. So, as most of you know, Humana's focused on addressing the needs of the whole person by co-creating solutions to address the social determinants of health and the health-related social needs of our community and our members. So the BOLD goal was established in 2015 as an aspirational goal to improve the health of our members and the communities by the year 2020. Well, now, we utilize the Center for Disease Control's, the CDC's Healthy Days survey to measure the progress we're making in the community and with our members. Measurement is very important as we start to look at these things. So as we reach 2020, we realize that many of the things that we're trying to impact are deeply ingrained, and they would take more effort, focus, and collaboration to drive the changes that are needed. So we set new goals, we integrated deeper within the Humana business efforts, and cultivated new community and national partnerships to continue improving the healthy days of our members and our First Coast. So as we know, a person's health is greatly impacted by the socioeconomic and community factors as well as their lifestyle choices. So now with the COVID-19 pandemic and the associated new challenges, the factors are more noticeable and the work has become even more important. So when we started here in Jacksonville in 2016, we were 8 communities. Well, now we're up to 16 cities. We've developed a Humana military population health effort here in Jacksonville, as well as in San Antonio, to address the specific needs and challenges faced by our active duty military members and their families. We've also integrated deeper into the Medicaid and commercial business segments. We have academic partnership teams that are working with academic institutions across the country, including one that we were working with UNF here in Jacksonville. And we're continuing to build and innovate the BOLD goal. And I want to thank you for all being a part of it and joining us today. And I want to thank Edward Waters College for hosting us and for having the important discussion on how COVID-19 has impacted food security and food access here in our community, and how the challenges we've faced have led to new collaborations and innovative solutions to this issue. So with that being said, I want to bring out our panelists, our first group of panelists. So Rahman, I'll go ahead and introduce everybody. So we're going to start off first with Dr. Courtney Walker. So Dr. Courtney is with Novo Nordisk, a medical account director with Novo Nordisk. He works in the Texas, Louisiana, and New Mexico region, specializing in efforts around diabetes and obesity. In his role, Dr. Walker spends time consulting with Medicare and Medicaid organizations and responsible for drug formulary decisions impacting millions of patients throughout the country. Additionally, Dr. Walker engages with large companies such as BP, Southwest Airlines, AT&T, and U.S. Steel that are concerned with the clinical crisis of obesity and diabetes in their employees. His aim is to assist these companies with the improvement of their employees' health via proper medical management and education. So Dr. Walker is a proud graduate of Texas Southern University University College of Pharmacy, and Health Sciences in Houston, Texas. Upon completion of his doctorate in pharmacy, Dr. Walker completed a pharmacy practice residency with Humana in Louisville, Kentucky, as well as in Lexington, Kentucky. Prior to his role, he's worked as senior outcomes liaison with Eli Lilly and Johnson, focused on rheumatology, dermatology, oncology, and autoimmune disorders. He's completed more than 17 years of pharmaceutical industry experience and has given hundreds of clinical presentations across the country, including TD Jakes' MegaFest 2017 in Dallas, Texas, where he was streamed to over 100,000 participants. So Dr. Walker is very engaged in his community. He serves as an elder in his church as well. He has his wife and 4 great kids. So thank you. Welcome, Dr. Walker. Secondly, John Rivers, excuse me. John Rivers is the CEO of 4R Restaurant Group and the 4 Roots Farm. So after retiring as president of a $1.5 billion company and a 20-year career in healthcare, John decided to pursue his lifelong dream of opening a restaurant. In 2019, John created the first concept, 4 Rivers Smokehouse, which quickly became one of the fastest growing restaurants in the Southeast, Delicious Barbecue, with 17 locations in Florida and Georgia. He also has couple of others, Southern Expired Coop Restaurant and Latin Infused Cantina Barbacoa at Disney Springs. He's been named the #1 barbecue restaurant chain in the country. Southern Living dubbed 4 Rivers as the top barbecue in the South. And Nation's Net Restaurant News recognized 4 Rivers as a top 5 breakout brand. So John has twice been invited to cook at the prestigious James Beard House in New York City and has enjoyed participating in Food Network's South Beach Wine and Food Festival for the last 8 years. He has appeared on numerous television shows and has been featured in national publications including Food and Wine, Bon Appetit, USA Today, Business Insider, and Cooking Light magazine. He's also authored the Southern Cowboy Cookbook and launched a line of retail and manufactured products currently at Publix and Costco and being distributed nationally by partners such as Cisco and US Foods. So as this year in the community faced an unprecedented public health crisis, he helped to organize a network of local restaurants, hotels, and hospital industry organizations to join forces alongside the Florida Department of Agriculture and Consumer Services to launch Feed the Need Florida, a program that provides needed meals to food insecure students and their families across Orange County and the state of Florida. So welcome, John. Thank you for being here.
Thank you, Paul. It's a pleasure.
Next is Jennifer Spear, and Jennifer Spear is one of my colleagues on the Bold Goal team. She's a population health strategy lead. Jennifer's in charge of executing the interventions and programs that address food insecurity in Humana's member population and the communities that we serve. Additionally, she works closely with community partners, the clinical community, and other partners to address the health-related social needs, particularly around food insecurity and in people where they're receiving care. She previously led employee awareness strategies dedicating to raising awareness around the importance of social determinants of health. And prior to her role working with food insecurity, Jennifer implemented a member call programs that focused on healthy days assessments and helping to track our progress towards the Bold Goal. So welcome, Jennifer. Thank you. And last is David Juros, who is the Director of Program Partnerships with Wholesome Wave. He joined Wholesome Wave in 2017 and manages a team responsible for the expansion of affordable, healthy food access for low-income populations. And launching the Wholesome Wave Tangelo app, which is really exciting. Prior to joining Wholesome Wave, David worked at American Express as a brand marketing companies where he managed relationships with large employers, supermarket chains, financial services companies, and institutional food services companies. David created a nonprofit organization based on the vision of his son, Devin, called the Pleasantville Community Garden, in which 6 years he had grown, gathered, and donated nearly 90,000 pounds of fresh fruits and vegetables to area food sharing organizations. So welcome, David. Appreciate your time joining us. So Rahman, thank you. I'll let you get started.
Paul, thank you so much. Thanks for all those introductions and welcome everyone. Thank you for being here again. I wish we were in person at Edward Waters College, but in time we will get back together. And you will all promise me that you must come by EWC. You got to come by campus, please, please.
Absolutely.
So to get started, I think the easiest question or it's the hard question, but I think we want to start with you, John, is because one of the things that we see or have seen in this pandemic that we've gone through is that it affected more than what we thought. And I want to bring you into it because of your being a restaurateur. I was able to work with some teams here at Edward Waters College, some of the local restaurants in the state of Florida, and we went to the farm down here in Jacksonville, in the Jacksonville area, and was able to get food distributed through the Shell Suite Center because the food was rotting because there was nobody to pick the food. There was nobody going to the restaurants to buy the food. How important is it that business get involved in? What are some of the things you're seeing other people like yourself in the restaurant industry doing so that this crisis is met with some sustainable work?
You know, that's a great question, and thank you for bringing that up and you said it perfectly in the opening video. It takes an entire community. You know, hunger is not caused by one single act or entity or problem. It's caused by a myriad of different things that are contributing to it. And in order to fix it, that means all these different parties have to come together and hit it from education to access to teaching farmers, how to farm responsibly, and also too from reducing waste that's around the state. People don't know it, but in the state of Florida alone, and I should say this, we didn't know it before we started getting into this. Every year before COVID-19, there's just shy of 1 billion pounds of produce that never makes it off the field, that goes to waste, that gets tilled under or goes into landfills. Meanwhile, you've got 20%, 25% of our student population living in food insecurity. And that was one of the big moves for us that motivated us to start our farm and ultimately to get into Feed the Need. And Feed the Need came to fruition simply because we saw when the public schools came back from spring break last year, the Department of Agriculture enacted the summer meal program. And when they did so, they found that we called them gaps in every community, every county throughout the state, where students were either not able to make it back to the school to get the meals, or that those school sites just didn't cover all the students that were needing of food. So we stepped in as an organization, mainly because all of our assets went dark. When all the restaurants across the entire state shut down because of the state mandate, you had employees, you had trucks, you had kitchens, you had tons of available assets that could be put to use, if not for the business, then to help the community. And that's exactly what happened. And this isn't just us, by the way. There are over 900 restaurants across the entire state that joined our network when we put out the request to either send food or just sign up to become an available partner to go help us address some of these food insecurity areas anywhere. And we've got now restaurants from tip to tip. Matter of fact, I was just on the emergency call this morning for the hurricane that's coming through, because now we're the appointed public sector that's helping address these issues. And what was unintended but was a welcome surprise is we learned that all this produce was going to waste in the field, and you had all these students and all their families that were hungry, and all these restaurants that were shut down. And we simply tied the three together. We started working with Feeding Florida, subsidiary of Feeding America. We worked with all the food banks. We started going out actively to farmers across the state, asking them, instead of letting it go bad, please give it to us, or we'll even pay you a harvest fee so that you're not losing money. We took all that produce and we brought it into our commissaries and catering facilities that were shut down. We hired people in the restaurant industry that were let go, and we produced meals not only for those students, but for their families. All in all, we rescued over 600,000 pounds of produce. We created 322 jobs. And as of last week, we put out 1.6 million meals in 47 different locations in 6 different counties throughout the entire state. And The one thing that's jumped out at me, and we talked about it a little bit last week, the people that we're feeding today are the same people that were hungry before COVID-19.
Yes.
And they're not hungry because of COVID-19, just it's been elevated to the public's eye of just how prevalent hunger is in our community.
There's one question, or not a question, a comment that comes in. I think this person is just in love with barbecue. He says, John Rivers come to Louisville on 4th Street live. So I think they just want to bring that to Louisville. One of the things that I know you, Dr. Walker, are very passionate about is ensuring that diabetes and other ailments that nutrition can help to put aside, that those things aren't problems in our community. And one of the things that the Center for Disease Control and Prevention has said is that people with these underlying health conditions, like diabetes, are more susceptible to the ravages of COVID-19. Additionally, we understand that people of color specifically are disproportionately, COVID-19 is striking them at higher rates with mortality and with illnesses that are diminishing their quality of life and way of life. So what are companies doing to help prevent, if COVID-19, God forbid, does touch a family? What are companies like Novo Nordisk and others in the medical device and medication industry doing to help nutrition so that people don't have to end up needing a ventilator or on something that could change their lives?
Raman, thank you so much for that question. It's definitely been a moving target. So since the beginning of the year when COVID-19 began, what we did at Novo Nordisk is we developed clinical information to be able to share with our partners, to train them to understand what COVID-19 actually was, to understand it as a virus, to understand how it ravages the body, what symptoms to look for, and to make sure that they understood it as a disease, number one. Number two was to then talk about the impact that obesity and diabetes have both had. We understand that from a hospitalization standpoint, the number one indicator for someone being hospitalized with COVID-19 was age. Age was the major determinant, especially those who were 60 years and higher. It was a high hospitalization rate. But second to that is obesity. And so obesity, from the standpoint that the United States of America, when you compare us to other nations that were ravaged by COVID-19, China, for example, only has a 6% prevalence of obesity. But then secondly, when you look at Italy, it has a 10%. But we're currently in the United States at 42% prevalence of obesity. So when you consider 7 times that of China, you look at the impact that obesity has had, and it's been pretty significant. So education has been extremely important. Then when you look at down the line, cardiovascular disease and then diabetes. So what we've done is we've worked to partner with businesses, health plans, state government. Number one, in education, making sure we educate as much as possible and making sure that understand where our products are relevant to disease where needed. But then to partner and bring organizations together. We have programs in place such as Cities Changing Diabetes that takes place in Houston, Texas, to help reduce this obesity. But then to partner and bring, we work with Humana there in the Bold Gold Initiative in Houston, Texas. But we also work with entities such as the Hope Clinic, and they're specifically designed to impact the community by educating them on diabetes management, but also nutritious and healthy food application into everyday aspects of their lives. We also do that in the Dallas area, working as well. And we also do it with organizations such as Farmhouse to Your House in the state of Mississippi, which is number one in diabetes, number one in obesity in our union in the United States of America. So working in those partnerships. And what's unique about the Farmhouse to Your House in Mississippi is that it specifically works with local farms in addition to a diabetes prevention program, which is designed to help to reduce the impact that diabetes is having on the community as well, and community organizations. In Houston, we also work with faith-based organizations to impact our community as well, to impact and really reach those individuals who are not getting tested, who don't know their numbers. So it really is about collaboration and engagement, Raman.
And one of the things that is interestingly said, we don't have on this call right now someone on the panel yet. I know Dr. Seymour is coming on later today, Brian Seymour, who is my colleague at Edward Waters College. But one of the questions that was asked if there'd be a representative from Newtown, and the answer to that, Ms. Habdi, Mia Habdi, is with the Newtown Success Zone. And although she's not on the panel, she did leave some information, and it says specifically Northeast Florida, Feeding Northeast Florida is engaged in Project Share. We've been able to provide 19,000 healthy prepared meals just in 32209 alone. And I know in the work that we've done together, we've been able to pull in roughly, from my understanding, 500,000 pounds of food to people. So thank you to everyone, all of the partners that have come together to work with us to ensure that our community is taken care of. I want to ask Jennifer, I know you handle population health strategy, and the bold goal is that the communities that Humana serves will be 20% healthier by 2020 and beyond. Help us understand a little more of that goal, if you will, and where we are now, and then some of the things that we can do, because all the time, you know, as Representative Davis said earlier, it's about public, private, government partnerships, right? It's all of us working together. But the other part, I think sometimes that we leave out, and I sometimes forget it as well, it's what are those individual things that you're doing? I happen to like to work out and eat healthy and put fresh fruits and vegetables in my diet for me and my family. But what I've taken to doing is kind of each one teach one, you know, telling people you don't have to be completely vegan. You don't have to go cold turkey. But if you make these small steps individually, it adds to a healthier community as a whole. So help us understand what are the individual things as well we can do and where we are en route to that 2020 goal.
Sure, thank you. So really excited to be here with you all today. And whenever we think about our bold goal to improve the population, to improve the health of the populations that we serve, we think about community in so many different ways. There's the local community, there's from a national perspective, there's pockets of our membership, and then obviously the communities that we each live, work, and play in. And so it's obviously 2020, and we have a lot of work to do. We all know that a lot of great work that had been done has been somewhat undone with the pandemic and the implications from it. But we know this work does not stop. This is very much operationalized into our business. And really what we're looking to do when we think about improving the health of the communities we serve, what are those programs that work, and how can we prove those health outcomes and improve that health and show the changes that we're making? We would all like to, you know, really think about this just from a philanthropic standpoint, but there are business implications that can be made behind this. And so a lot of the work that I spend my time doing is working within the business, working with our national partnerships that then trickle down to the local level. For instance, we have a large partnership with Feeding America, and obviously there are 200 food banks across communities that are serving at that local level. And working with the food banks and other partners to really find, so I work in the space of food, so that's what I tend to speak to, but within food, to the point of everyone on here, what are those programs that work? And then how do we scale those? How do we really put all of that effort behind those programs that work, to scale those out to more communities, to understand every community is different. So how do we take what might maybe worked in Texas, and how do we apply that to somewhere like Louisiana? My counterparts in Louisiana, every time I bring them something, they say, you know, well, how do we make this local? Because we eat different here in Louisiana, and I think that's true for so many of our communities, that food is so cultural and it's so personal to so many, that how do we actually make this, how do we make it personal to the community and all of the individuals within it? So from the standpoint of where are we, you know, we all have a lot of work left to do, but I think that we are committed to this work and to expanding this work far beyond 2020. This is so ingrained in our business and our everyday operations now. And that's really one of our goals, is to take this from this North Star, dream with a deadline, as our bold goal we used to refer to it, and really just making it a part of the operating model and just the way of life that Humana approaches business.
And Jennifer, it's interesting. I one of the things that I say as well when it comes to fitness and working out, that it's not a destination. It's a journey. We're all going to be, and Courtney, I'm sure you'd agree with me too. Like when it comes to health, we get up and the older we get, the way we do our lives, it's these little incremental things that keep us having a better quality of life. So I totally agree with you there. David is someone, and your background is quite interesting. I want to talk a bit about the nonprofit that you created, that Pleasantville Community Garden. In 6 years, you've donated 90,000 pounds of fresh fruits and vegetable in Westchester County in New York. And it was based on a vision from Devin, from your son. And so I think that's the really cool thing, is it's all about everybody getting involved. But if you could tell us, like, how did you get from the idea of creating that into making it a reality? Because that's something, again, when you are in a place where there are health issues, if you start out healthier and get sick, you have a better chance of fighting whatever the thing is. And nutrition is where it starts. So if you could give us a little background on that, and Wholesome Wave, and how communities can benefit from Wholesome Wave that may not be in your area.
Terrific. Thank you. Sure. I'm happy to talk about that from both angles. Number one, with Devin was 11 years old and heard about food insecurity in school and decided that he really wanted to do something to make an impact in that. And it took us 2 years to put together a plan with the community. We had a lot of input and help from the community to build a garden, and then expand to school gardens, expand to collecting at our local farmers market, and even running food sharing events. But it's truly been an entire community effort to be able to do this and have the kind of impact that we've had. From the Wholesome Wave perspective, it's similar, but on a much bigger scale. Wholesome Wave was founded by Michelle Nishan, a chef who has 2 sons who were born with type 1 diabetes. Understood quickly, and being a chef, that he had to feed his family differently, but also realized quickly that not everyone can just make that change and shift their spending to more fruits and vegetables, better nutrition to help their family be healthy. So that is truly the fundamental basis for Wholesome Wave's work. We do a lot of work with nutrition incentives, money that can be used only for fruits and vegetables, with a lot of different platforms. We've really expanded over the past couple of years into the technology space to be able to scale the work that we do. We've had great impacts in the populations we've worked with for many years, but now taking that to technology to be able to scale the work that we do and help more people has been the mission over the past few years. It's helped us greatly as we've gotten to the issues of today with the global pandemic, because we now have these platforms. We have an app-based system that Paul mentioned before. We use card products and many different ways to be able to efficiently and effectively get the money to people to change their lives in many cases. It's been disheartening for me over years to hear people tell me that fruits and vegetables are luxury items. It shouldn't be. It shouldn't be a luxury item. It shouldn't be a question whether you can afford them or not. But that is where we are today, unfortunately, and the work that Wholesome Wave is doing to scale is helping to bring this to populations at a much higher level than before to be able to help. And during this pandemic, it's been critical. We actually are working in the city of Los Angeles on a program to get food to about 23,000 families. Starting this week, starting today actually, and running for the next 5-6 weeks. So this has really created the need for scale, and we're so glad that we're able to participate at that level.
And the understanding as well, and thank you for that, because that's something that communities themselves need to know how they can pull together to make this thing work. So as we're doing it, what are the next steps? And it reminds me, I remember one of the first times when I moved back to Jacksonville, and I was in Whole Foods, and I was in line pre-COVID, of course, where we could talk to people we were close in line. And the lady said, she made a joke about Whole Foods being called Whole Paycheck. And we were there just trying to get some food to feed the family. We were laughing like you leave with a bag of food, literally, and you're spending no less than $100. And for some people, that's just not possible. What is it? What can we do? What can government do? Representative Davis is listening. I know Congressman Lawson said he'd be tuning in as well. What can people in government do to help so that people who want to just have healthy food to feed their families so they don't have to go through this to anyone?
I'll go ahead.
Go ahead.
No, please go ahead, Dr.
I think understanding that when you take in consideration Whole Foods, they have a relationship with Amazon where their prices have dropped by 30%. So I think there's the perception to eat healthier is more expensive. And because of this perception, you've kind of created this, I work with my family where some of them even, like, should I even try to eat healthy? And so I tell them, hey, get the Amazon app and you can use the app at Whole Foods. It provides a discount. You get it clicked every time you go to Whole Foods. And then Whole Foods is a great store because it actually lets you, their 365 brand, you can actually test certain foods there. Just mention it to the front door when you go there. But there's a perception that to eat healthier is more expensive. And that's just really simply not the case. And David was making me think about there's organizations that have really made it their objective to provide healthier foods. The food desert crisis is destroying our cities. There are places in the city of Dallas where we know that people live 2 hour bus ride, from 2 to 3 hour bus ride from the nearest grocery store. So it creates a situation where they're like, why should I even try? And I can buy greasy, unhealthy foods very closely. But we have to fight for organizations such as Bonton Farms here in Dallas, where a gentleman came in the zip code where it was the highest concentration of cancer, diabetes, obesity, and it was directly linked to the foods in that community. And he created a inner city farm, and that inner city farm has impacted the neighborhood in a tremendous way. And these are popping up all over the country. And I think we have to support those farms and then also support grocery stores in helping people understand. We work with HEB and their nutritionists and dietitians who work with their employees or their partners, specifically as they call their employees. And we work with them specifically in helping design programs in nutrition for their employees. So I think it's creating a perception that to eat healthy, it just doesn't have to be expensive.
John, I think you want to jump in. Oh, go ahead, Jennifer.
Sorry, I was just going to say, I'm also really, you mentioned HEB. I know Aldi recently, really happy to see additional grocers coming on to the online SNAP usage. Before there were some limited options, which were wonderful, but I don't know about you all, but for me personally, when I'm able to do my grocery shopping online and not in the store, I am able to make those better choices, and my bill always seems to be lower. So I think that the more vendors that are coming on to either being able to use SNAP online for delivery or for pickup is just not only making life somewhat easier, but the more grocers and stores that are on there, the easier it just makes for the community at large.
Jennifer, she raises a great point too, because SNAP has been expanded with the Supplemental Nutrition Assistance Program in our country has been expanded all over the country, and they've added millions of dollars to really help in assistance with COVID. So I'm so glad Jennifer mentioned that, because that's extremely important as well.
Yeah. And Courtney, and both of you guys, you brought up great points. There is reimbursement available, and it is through SNAP. So the reimbursement is there for that population, and it's not just access alone. Okay, if you talk to one of my friends runs the food bank here in Orlando, and he is distributing more food today than he ever has in all their history. But yet today, food and hunger and deprivation is at the highest point it ever has been. He's got a great saying: "You can't food bank your way out of hunger." Access alone is not it. In some of those communities, we brought in broccoli, we brought in eggplants, stuff that we're rescuing from the field. The people in that population, they don't know what to do with it. You can bring it to them and you can tell them that you can double your SNAP benefits, which you can, and a lot of grocery stores that are out there if they're buying healthy fruit. But that's not going to turn it. It starts with education and reaching into those communities and teaching them, one, the importance of that relationship. God gave us this land to provide everything that we need. Okay. And if they don't have that respect and understanding that, wow, green beans don't come from a can. it actually, and I'm not joking, it actually comes from the ground, and we have that ability to grow it and then teach them how to do it. We've started a project down here. It's called Four Roots Farm. And we're taking 38 acres that we've been blessed with, that one of the local charities has given to us. And we are developing, it's a $30 million project, an urban farm campus that we're bringing in students from. It's right in the middle of downtown Orlando. We're in one of the poorest areas. We're teaching them how to generate urban farms and in their own communities. And we're going in and we're helping them build those. We're bringing the junior college students on and teaching them about regenerative agriculture and the importance to it. And we're launching something that's incredibly, and I think it's very important to our community, is that the National Institution for Culinary Health. Using food as part of medicine in your treatment. And we're calling it culinary health because it's not just in disease treatment, it's lifestyle. Yeah. And it's learning. One of you guys said it earlier, if you eat healthy, you have it doesn't necessarily keep you from getting sick, but you have a much better chance of getting through this in a shorter pattern with less implications or ramifications to your body. So I'm a big fan of education and bringing it to even the grade school level and start teaching folks and young kids their minds, where food comes from and the importance of it.
I'm looking at, go ahead, David.
Sorry, just wanted to jump in on two quick things that John said. Our programs focus on access, affordability, and education just for that reason. One of the great effects, we do a lot of programs that are pediatric based. And one of the great things we see is once there's money available for fruits and vegetables, parents will feel more comfortable letting their kids test new things and try new things out. And trial is really, really important for kids to be able to understand and like more foods. So we always see that as part of our pediatric program. The other part of what John was mentioning that I'd like to just jump in on is the relationship between nutrition and healthcare. A lot of our programs these days are fruit and vegetable prescription programs where healthcare providers can actually prescribe the nutrition incentives that we offer to their patients. So oftentimes this is patients with obesity, heart disease, diabetes. The beauty of looking at the impacts of these programs is that the healthcare professionals follow along with the progress of these patients, these participants, and track the biometrics alongside of the usage of the program itself, the usage of the funds for fruits and vegetables. And we see these great impacts where people are lowering their A1C, they're lowering their BMI, they're becoming more healthy. And we get the stories alongside of it, which really tell the entire story around the change by just adding fruits and vegetables into their diets.
Absolutely. And we all will get older. We will go through those changes, but to make these small steps, it helps us to have a better quality of life. I want to bring in, I see a comment there, and I'm going to put it up on the screen so everybody sees it. Travis Mitchell, who works for UF, who's watching. Thank you, Travis, amongst everybody else. He said he wanted to mention that they are helping University of Florida, anyone interested in growing food. So they're available. Thank you, Travis, for making that available to us. And I also want to mention, I know one of Representative Davis's close friends and colleagues, City Councilwoman Jacoby Pittman, who is the director of Clara White Mission. They have something called White Harvest Farms, where Clara White Mission actually does exactly what you're talking about. They grow food in this community. They help people get access to those healthy food products. So, John, I think it's really great, and David, all of us, if we can figure out ways to connect the dots. I see some comments where people talking about, I want it in Louisville, I want it here, I want it there. We, I guess, are figuring ways, and as technology binds us together, finding ways to pull us together so that we can connect those things. Some startling statistics, and I know we only have a very short amount of time before this panel ends and we go to our next panel, but I wanted to bring up some statistics. And if you watching at home or wherever you are have questions, feel free to leave your comments in the chat. We're going to get to as many of them as possible. I also put Paul Sapia's information there from Humana, who is going to be a clearinghouse and going to be available for everything that you need. He's got you. So make sure you look at that email address and reach out if you're in a community organization that needs help. Humana is there for you. And we thank you for that partnership. I'm looking at some of these numbers, startling statistics. And this is strictly from the Humana Bold Goal Health Equity Issue Brief, and it speaks to COVID-19. This is reported by the Black Humana Medicare Advantage members. This is in 2019. The unhealthy days has gone up to 16.8 unhealthy days. Again, the COVID-19 mortality rate, predominantly Black U.S. counties. Again, this says predominantly Black U.S. counties, a 6-time higher mortality rate for COVID-19, strictly by the numbers. A Black adult is likely to have high blood pressure 40% more than a non-Hispanic white adult, putting them at greater risk for heart disease and stroke. And for women, this increases to 60%. Basically, this report, and there's so many great statistics and numbers, but it talks about the bias and the reasons for these inequities. Sometimes it's a lack of distrust. One of the things they were saying here, only 2.8% of physicians were Black or African American, only 3.8 were Latino. And so sometimes there could be mistrust. What can we do to get people to try to walk in the path of being healthier one by one, so that if, God forbid, there's a COVID-19 or a SARS or any H1N1 or whatever may come back, that they, as John said earlier, that they have a fighting chance? How can we get to people who historically are saying, and that's just it, I'm just, my family has diabetes, and I don't know, Courtney, maybe you, because you work in this field and you are, a pharmacist, but what can we do?
I think we have to be very honest about where we've come from. I think we have to be, because the COVID-19 has exposed the truth. It is exposed that there are inequities in our system, and it's called structural racism, where societies that foster discrimination through mutually reinforcing inequitable systems. And these inequitable systems really are connected to what we call, what you're hearing more so about, social determinants of health. And that's access to quality care, that's discrimination of any sort, that's education. Those who are educated are shown to have better care, employment, food security is what we're talking about today, income levels, safe housing, social support. All of those things play a role in determining the health outcomes. And COVID-19 has really worked to highlight pre-existing health conditions, specifically in minority communities, specifically the African-American community. The most recent data says that it's like 108 deaths per 100,000 in the African-American community. That's almost double that of seen in the white community and Asian community. And specifically, it has to do with the pre-existing health conditions. That also, and right behind is the American Indian community, and also the Hispanic community. I think we have to be very honest about what's going on and what has happened, because the only way to move forward is to remove medical mistrust. In the African-American community, we have a significant history, Raman, that we have to be very honest about. We have to be honest about the Tuskegee experiment. We have to be honest about Henrietta Lacks. And I think that's why it's so very important that we partner with faith-based organizations within communities to connect to the hearts of the people, to help them move forward to, number one, being aware, and then challenging our state officials and our government officials to move in the direction of policies that will open up access. And when we have open access, we will definitely see the steps begin to improve the health in our communities. But we have to be honest about where we've been as we move forward to address some of these issues.
Yeah, I agree. I think one thing that Wholesome Wave has seen and been a part of is being a lot more intentional. As Courtney had said, that a lot of these issues have been brought to life and light during this pandemic, and being a lot more intentional on how we're going about targeting populations, how we're going about getting this money to people for fresh fruits and vegetables. The program I mentioned that we're launching today with the County of Los Angeles was purposefully targeted to organizations who work with immigrant populations, undocumented populations that don't get the kind of help they need. Unfortunately, the SNAP program, although it's a great program, the roles on SNAP have been lowered over the past couple of years, and people are in some cases afraid to use the program. So you've got people who need the help the most aren't able to take advantage of that. And that's why the intentionality of seeking out the right populations to work with and to bring this help to has been so critically important during this time.
And I think one of the key things you've said, David, is about being intentional. And we got to have, Representative Davis said it earlier, and we said it, the uncomfortable conversations. Yeah, there have been the Henrietta Lacks situations and others. We've got to have the uncomfortable conversations to get to a place where things are happening. Speaking of, I see a former state representative, Mia Jones, said there was a garden at the bridge in Jacksonville, now the Boys and Girls Club, that's been abandoned. So we got to make sure, as we as a community, and thank you, Representative Jones, when we are in these spaces, we too have to take our dollars and our time and say, what can we do to empower our community? I see a couple of things. People have asked, how do we incorporate this type of learning into early education? How do we get this? Dr. Kimberly Davis says, it's important, and it's easier to, teach a puppy than it is to train a dog, right? And I don't mean to refer to any of us as that, but that's the thing. Let's start up as kids. I know with my cousins and kids and family that I try to make sure that they understand the necessity of making healthier choices. How do we get that in and not end up in a space like, God forbid, we all saw what I thought was a great thing by Michelle Obama a few years ago, and she was just working to help people eat healthier, and she was barbecued for it and called, being too motherly. How can we get that into the educational system and let people know that it would help them for the future?
I'll go ahead. And, the education system, there's 3 great springboards that we found in any community, okay, to get the message out there. One of those springboards is actually the education system. We've partnered here with OCPS. We've gone into 2 high schools, and we've actually built agriculture programs where we've partnered with IFAS, who's one of our great partners as well. And we brought in a hydroponic system. We built the greenhouses. We got it funded. And now there's over 250 students just at one high school alone that are producing all the produce that's actually being sold in the cafeteria where they're eating it. And we just launched our second high school at Edgewater, excuse me, just a few weeks ago, and they've already got 200 students that are starting to learn from it. So, going into the public schools, it doesn't have to be a high school, and helping them build out an agriculture program, it does take funding, but the resources and the know-how are readily available just from IFAS alone, all over the entire state. If you can pull together the funding and go into it. Now, the representative made a great point. So many of these initiatives start with good intention, and then when that beneficiary that leaves and steps out of it, if nobody has the passion to carry it forward, it'll shut down, it'll die. So that's an important piece. The other 2 areas that are great springboards that anybody can do in their communities, one of them, think about who's serving a lot of these populations and pockets where the food deserts are, and they're churches. So we're starting a program. We're starting to go to the churches now in the most underserved areas of town and helping them build an urban farm, a self-sustaining one, that they can actually sell the produce back to their neighbors and the people who need it the most. So you create a closed loop system in doing that. And the third one, and this is for Humana, is in a great position to do this, is a physician base across the United States. If physicians aren't telling the patients about the importance of utilizing food and bringing it into their diets, That's one of the most number one trusted sources that are out there is your doctor. And the average physician today coming out of med school in the United States has 1 hour of nutrition classes in their whole curriculum. So helping them, bring them up to speed, they're going to be able to influence a tremendous amount of patients and the population of going and utilizing food as part of their health regimen and their cycle.
Hey, Raman, in addition, John made me think of, at Novo Nordisk, one of our ambassadors is Reverend Run from Run DMC. And I was very privileged to be on a panel with him a couple years ago. And one of the things that he said was make healthy eating cool. He says when his friends come to his house, he has fruit and vegetables sitting on his panel and has he asks them questions. Hey man, do you know your numbers? Do you know your numbers? Instead of a candy bar, let's get an apple, let's get an orange, let's get a banana. And making healthy eating cool, and so with our kids, what we do, we'll bring them together, we'll slice Brussels sprouts and we'll sprinkle a little Parmesan, put it in the oven, talk to them about the benefits of fresh fruit, because John made a very good point earlier. Of what we're seeing here in Dallas is the community, the Beta Scott and White Diabetes Wellness Facility, they teach a cooking class and they teach people how to come in, how to use the lettuce, how to clean the lettuce, how to cut the eggplant. Those things have to be done. And I think there's more opportunity now to get those culinary classes to help eating healthy be considered a cool event.
Any others? I know here we see the American Heart Association in St. Louis said they do curriculum. I know we partnered with the American Heart Association here to do one of their initiatives with our students here at Edward Waters College. Any other ideas education-wise?
You know what? The Department of Ag in Tallahassee has tremendous curriculum that's readily available for public school systems throughout the entire state as well. There are programs already written, developed, ready to go. It's just now it depends on the school to reach out to them and build that into their curriculum for their children and their students.
Another group that's done a great job, especially during the pandemic, with electronic nutrition ed is Cooking Matters, a division of Share Our Strength. Incredible amounts of nutrition education for kids. We've partnered with them to bring our nutrition ed to children through their programs as well. So it's another one I would recommend.
All right, as we begin to wind this down, we do have another panel that's going to come, and we want to continue this conversation. So as many as we can, we'll ask to stand by. There's some great comments that are coming in I'm so glad that everybody's watching it and no one's gone and more people have come. That's a good thing. If you also continue, if you're watching from home or anywhere else and you have comments, please make sure that you leave the comments below, and we'll make sure to get to as many comments as we can so that you can be a part of the conversation. As we wrap this up for our national and move into more of a local space, though, are there any final thoughts on what should be going on with state and local government? We know we have some governmental leaders watching. We know that people in the community are watching. If you had to leave them with one small bit of advice, what advice would you give them?
I guess I'll start off. I'll say, please pay attention to what COVID-19 has unearthed for us as a society. I think COVID-19, the impact of this disease, has heightened our awareness that obesity is a significant problem, and that we have to take the steps necessary to turn things around so that we as a society are healthier. And then partnerships and collaborations are so desperately important. Everything that I've heard here has been around partnerships, collaborations. That's what we're trying to do in Novo Nordisk. We're trying to partner and collaborate as much as possible to make an impact. So thank you so much for this opportunity to share.
And I would agree. I think the collaboration aspect is so critical for local, state, federal government to collaborate with both national nonprofits, very local nonprofits, all need to come together because everybody has a different view of the problem and of the issues and different solutions to bring to bear. So I think collaboration, listening, working together, understanding how the problem can be solved from many different angles, I think is critical right now.
And I think really important to that is listening to the communities that we are all serving and working with. So in addition to working, the collaborations with partnerships is really understanding the communities and the need that's there and what those community members want and what they see as the biggest issue. Because, food might be just the tip of the iceberg. And so how do we really address those root causes to then get to addressing some of the other issues?
And to me, everything starts with education.
Yeah.
Be it students, the greatest plants and seeds that you can plant are trees and fruit that bears, long years after you're gone, because that's going to drive change. And quite frankly, education for our community. People don't realize that the average fruit and vegetable travels 1,872 miles in the United States, before it gets to our plate. And until you're aware of the problems, or people don't know that 20% of our population lives in food insecurity in our own backyards. Until people are aware of it, they're not going to take action about it. So I would keep doing exactly what we're doing today and raise that message, get it out to the public, and get it into the students' hands and teach them, get people passionate about driving that change.
Thank you all for participating in this panel. We'll start our next panel in just a few moments. We'll be right back. Again, we appreciate your time.
Humana has a bold goal: to improve the health of the communities we serve by making it easier for people to achieve their best health. For the last several years, we have been working with community partners and physician practices to co-create solutions at a local level. Together, we are tackling chronic conditions and social determinants of health, such as loneliness, social isolation, and food insecurity, those barriers upstream from our traditional healthcare system. Why? Because good health is hard, and we cannot do this work alone. We are still learning. Help us move the needle on population health and be a part of something bold. Visit humana.com/bold goal for more information.
Welcome back. This is Humana's Bold Gold. I'm Rockman Johnson, and the bold goal is to make sure that populations are 20% healthier from 2020 and beyond. I'm a professor at Edward Waters College, and we're joined by some amazing panelists to talk about what we can do in our communities to ensure that things are better. Okay, I want to bring our local and regional panel up next, who are experts in their fields, who will be talking about why it's important for us to be healthy as possible, and what COVID-19 has done to hurt our communities. First and foremost, the president and CEO of Feeding Northeast Florida, who has taken a vision of reality and brought it to life. They've given away millions of pounds of food. She's done an exceptional amount of work and continues to do it. Please, let's welcome to our stage. This is Susan King. Susan, welcome.
Hi there. Thanks so much for having me.
Good to have you. Our next guest, Strategic Partnerships Coordinator for the Florida Department of Agriculture Division on Food, Nutrition, and Wellness. He serves under Commissioner Nikki Freed, our friend, and is responsible for organizing the office's efforts in communication. He's worked in the U.S. House of Representatives, the Florida House, and he is a FAMU rattler, so they strike and strike and strike again. Please welcome Mikhail Scott.
Hey, good afternoon. Good afternoon, everybody.
One HBCU grad to another. I had to do the rattler thing. There you go.
Absolutely. HBCU love.
All right. Our next guest, Assistant Professor in Healthcare Administration and the Operations Manager for the Center for Health, Equity, and Community Engagement at the Mayo Clinic. She does an extensive amount of work in making sure that communities are represented. She also is a graduate of Florida A&M University, and she also went to graduate school at the University of Florida. An extensive background and a wealth of knowledge when it comes to health disparities. Please welcome Professor Monica Alberti.
Thank you for having me.
Yes, and last but not least, my colleague, who is a recent grantor of a grant, I think, from the U.S. Department, and correct me, Dr. Seymour, if I'm right or wrong, but I think it's the Department of Health and Family Services. I'm not sure, but huge grant. He's doing some amazing research when it comes to the disparities as it relates to asthma and breathing, which, as we know, COVID-19 is a respiratory illness. So this is an important study that he's doing on the campus of Edward Waters College. He directs research in the Center in the Prevention of Health Disparities at EWC. He's also a tenured professor in biology and has done decades of research. My friend, Brian Seymour, Dr. Brian Seymour, welcome.
Thank you.
Thanks everyone for being a part of this. And let's get right into it. One of the statistics that I shared earlier is that people of color, and Dr. Seymour, you know this more often than not, and you've done research around the world, people of color, especially in America, especially in low socioeconomic areas, are suffering worse from COVID-19. Is it too late? What can we do?
No, there's lots of things we can do. First of all, we gotta change the thought of the people in our community. Now, this community, the community that we dwell in right here, it's called Health Zone 1. It's the most urban of the 6 health zones. And this health zone is basically 128,000 African Americans. But this health zone also is the lowest on the socioeconomic ladder. We're the most vulnerable. Why are we the most vulnerable? Because this health zone is stuck in the center of a food desert. You know, if you look at the definition of a food desert, we're talking about a one. This is in the urban area. A food desert, according to the USDA, is if you are in a 1 mile radius from the supermarket. Now, what is a supermarket? A supermarket is a big grocery store that actually makes about $2 million in sales a year. And we don't have any in this community. And because of that, our community, the people in our community have no choice but to go to the fast food restaurant. They have to go to the corner shop. And in the corner shop, what do you see over there? You see food that's high content salt, low sodium, no fresh vegetables, no fresh greens. And because of that type of eating habits that they have, it just sends us towards, obesity. That's what happens. And when this kind of problem comes around and you have a community, a population with a lot of obesity, people say, oh, well, it's genetics and it's genetics and, it's genetics and it's African American, it's genetic, but that's not true. When I came out here 10 years ago to do some studies, I collected some blood samples from these individuals. I did a preliminary on a small budget. I did a study and I was looking at allergy and asthma because they said that it is also prevalent in the African American community, and I was looking at a protein in the blood that's elevated in times of asthma or in times of parasitic infection. And what we found was that 65% of the people in the community, the people that I randomly collected blood samples from, had extremely elevated levels of this particular protein called IgE. And now this IgE, just like I said, is elevated at the time of allergy, asthma, or in parasitic infection. And I know that in this community, we don't have a problem with parasitic. This is for the third world. We don't have that problem here. So it had to be, allergy and asthma. Then I looked into the health department. The health department said, oh, that is Health Zone 1. And that community there, we have the highest morbidity and mortality rate from asthma, actually almost in the entire of Florida. And we also, and because of this, we have the highest emergency room admission. Now, you look back at this community, we don't have health insurance. We're the poorest, we're the least educated. And so we are the most vulnerable population in this community. So now when you have obesity and you have this problem of obesity, what it brings on? Hypertension, it brings on high blood pressure, it brings on asthma. And so my community this center that I work in, our goal is to try to fix the community. And the way we're going to fix it is we need funding so that we could receive enough assistance, from, some of you guys to help me continue to do the study to actually work in the area of education. We have to start educating people in our community so
Absolutely.
that we can work for ourselves.
Absolutely. Thank you, Brian. Susan, I think you're so right there. It starts in that space and it's a dollars game. One of the questions or one of the comments that came in from YouTube, Susan, it said, food insecurity is an issue of poverty. Access becomes moot when one has resources. I think that was one of this person from YouTube, Lauren Husband. Thank you, Lauren, for watching. I think it's so true. If the people had resources, it's almost like if you had the money to do it, you wouldn't end up in those spaces. What has your experience been like at Feeding Northeast Florida now that, and you've, obviously you've been on the corporate side, you're now a nonprofit, you've seen it. What has been this experience since COVID-19? Are you seeing a different kind of family now needing the services and resources that you provide?
I would say yes, because the numbers have been increasing so significantly. We still see the same families, the same households who suffer from poverty. I appreciate Dr. Lorraine Husband's comments there. She works for Feeding Northeast Florida, recently joined us, and we are so lucky to have her because she's helping us really address those disparities in specific communities, really drill down hard to how we can affect health outcomes as a food distribution and logistics business. But in terms of the increases that we've seen, even now, we are seeing about 30% of the people in our lines at distributions who have never accessed charity food before. The effects of the unemployment related to COVID are still being seen in a really significant way. Our mobile distributions, which is probably the safest way we've been able to meet community need, both in numbers and just by distribution method, have increased more than 350% since pre-COVID. Our number of agency partners, which is really pretty remarkable, has increased by about 40%. People, those churches that we spoke about, are stepping up to feed people in their own communities who see this need. And we're very heartened by that. And we look for them to be partners as we move out of this COVID pandemic. But the need still exists in these communities.
We're having a few technical movements. Please bear with us, as this is our first time using this platform. So I think it's gone smooth so far, don't you? Mikhail, I know you on the state level. Nikki Fried has been really huge in making sure no one even, I know when I served as an elected official some years ago in the Soil and Water Conservation District, agriculture wasn't a big thing. Commissioner Fried is making sure that it is, and it's something that back then when I was a part of it, it was more about the environment. And so she's doing her thing to ensure that has stepped up to the plate. Because again, when she ran, COVID-19 wasn't even something people were thinking about. What is it that your department is doing on the state level to ensure that communities are taken care of, some of the things that we may not know about that are a little less public?
Absolutely, absolutely. And as you mentioned it, Commissioner Fried has done an amazing job of really stepping to the plate as it relates to food insecurity and the conversations around it. Previously, when you think about agriculture or the Department of Agriculture, most folks just think about farmers, right? You're thinking the only thing that we're worried about are commodities and, our exports and imports on produce. But essentially, food insecurity and the way that our department actually addresses food insecurity goes a lot deeper than a lot of folks might actually understand. And since having the commissioner in office, she's made food insecurity one of the top initiatives that we're focusing on. And, we're able to do this through a lot of different ways, particularly through the nutrition and commodity programs that we actually provide through our department. Some of which people might be familiar with, like the National School Lunch Program, which provides students with, breakfast and lunch throughout the school days and throughout the weeks, which, since the pandemic has hit, we really found out how instrumental those meals are for individuals and how much these students actually depend on these meals, especially when we talk about those that are on maybe free or reduced lunch. These are sometimes the only opportunities that they actually have to receive these meals. And so some of the things that we've been doing around that program is advocating for universal school breakfast, making sure that kids are able to have the nutritious meals that they need in the mornings to perform better, to be better prepared for school, and to also just get their lessons and be more successful. Another program that we have that we've really been instrumental in providing access to students, particularly during the pandemic, is our summer break spot program, which is a program that provides students that are 18 years and under with free meals during the summertime. And this is actually a program that we were able to activate a little bit earlier than we typically do, due to the fact that school closures happened and students really didn't go back to school after spring break was over. And so through a lot of the strategic partnerships we've been able to create, we actually were able to launch 2,500 summer break spots after the spring break period ended and schools were still closed through March and May, where we were able to serve 42.6 million meals to students across the state of Florida, and working with a lot of our instrumental partners on the community level, helping us to find those gaps and really having nonprofit organizations and community organizations step up to the plate to work hand in hand with us, because, the title that I have is very important, but at the same time, that idea of partnerships is what we understand as a department that we have to do in order to actually have an effect in this area and really bridge the gap for food access. A lot of the programs that we've been doing that might not be as familiar, or some of the newer things that we've done throughout the pandemic, are creating programs like the Florida Farm to You program, which was something that actually helps farmers in a way, but also connects consumers to these farmers, so that we can actually continue that economic stimulus for farmers who might have had food that was not able to reach those traditional markets due to school closures and restaurant closures. And we're able to redirect those resources to our food banks and pantries, some of the more localized consumers who now had an opportunity to go and actually get fresh produce from the source, as opposed to having to try to find it through other ways. So we've been finding a lot of different ways to be innovative and provide access to students, particularly in underserved communities where we know those gaps exist. And, we look forward to continuing to work with statewide organizations, local organizations, elected officials alike, so that we can really draw down on what this issue is and provide more education and resources so that folks better understand what the face of food insecurity looks like. Because at this point in time, it's no longer the individual that might be homeless, or, someone that maybe doesn't have access to a job, or that might be unemployed, but it's literally, the four family home next door that maybe someone lost their job now. And so they're in those food pantries, or they're going to those food banks, just like some of these other individuals were. So that idea and that face of food insecurity is certainly changing.
I want to jump into, and you're right, when we look at what we saw just a year ago, it's different now. And the question is, how do we address it? And Monica, I want to jump into you, because you've done a lot of qualitative research, or come up with methodology and talking about how to engage populations in the community. I'm going to circle back and get to the larger group, but how do we get people more engaged? I mean, it's, and like I told you, Monica, I like to work out. I love going to the gym. I like to do it. As I tell people who want to get started in fitness, I didn't start because I wanted to look a certain way. I started to be healthy. My father died of prostate cancer. Both my grandfathers on both sides, both had prostate cancer and passed away. There have been other instances. My mother last year died from ovarian cancer. So for me, when I started 20 years ago, I started to eat better and work out and do all that, not because I wanted to look a certain way, but because I wanted to be healthier. And just in case something happened, I would have something to fight with. The byproduct is you can look all right in that pair of clothes, So my question is, how do we engage people to get them beyond just, I want to look good for my high school reunion or whatever, but to understand that these decisions that they make individually can affect their lives positively for the rest of their life?
Right. So I like to look at community engagement in a broader context. So even though, communities that we live in and some of the communities that we serve are seen as, underserved or low income or lacking resources, the one thing that I will say is that these communities are rich in assets. And the assets are those individuals and those community members that live in the community, that care about the community. And so one thing that we've done at Mayo Clinic, so when we started looking at, Health Zone 1 and all of the issues that have taken place in Health Zone 1, we went to the community, to the residents that live there, to say, what are the challenges that you see on a daily basis? And what do you think the solutions are? I think oftentimes in this space of health equity and community engagement and research and the work that we do, oftentimes we may come with the answers, and really the answer lies right within the community. So I think that that's the first step, is really rallying the community members and really being able to empower them to say, you have the answers to address the disparities that exist in your community. And we've seen that in the Newtown community and other communities that we've worked in. So I think step one is really engaging together. So in a broader context, engaging the community as a whole, but then also as it relates to individual engagement. So it's really meeting people where they are. So what we found in much of our research and the initiatives that we've done is that you have to meet people where they are. So, when we have our wonderful dietitian colleagues and our exercise specialists that are saying, we need to do, 5 to 9 fruits and vegetables and 150 minutes of exercise. And for some people, that just may be too much, but one small step. So in all of the education and all of the interventions that we develop, we really focus it from a place of what's one small change that you want to make. So I think that that's what's important. That's important in terms of engaging. So allowing communities to tell us as, the organizations that are wanting to partner what the issue is, and then on an individual level, meeting people where they are and allowing people to decide what are their small step to change.
Now let's talk on the bigger issue. Thank you, Monica. But on the bigger issue, what can we do right now? COVID-19 doesn't look like it's anywhere near going away. I know there was a comment earlier about some vaccines or any of that. What we know right now is there's no vaccine. What we know right now is that it's an issue. And even so, it'll be time before it gets to the community as a whole. How can we, and it takes time to build a grocery store. One of the things I saw some other places are like pop-up shops and ideas. What are some of the ideas? Because I'd like to leave here with some things. I know we have some electeds watching. I know we have some other community leaders. We've got Feeding Northeast Florida. What can we do that we can say? I know Tracy announced that she was going to have a food giveaway coming up just before Thanksgiving. What can we do that's for something that's sustainable, that we can start to have a paradigm now to work toward as we navigate this crisis? Anybody? That's anybody.
I would
Not
say
that I'm asking you to have all the solutions, because I know they're like, you want me to come up with the Spirit of Northeast Florida Hunger, but what are the things that we could do? I mean, to me, I'd love to have a pop-up shop or something where you can come and have it, but what can we do right now?
So I can share some of the things that Feeding Northeast Florida has done in response to COVID. But I would first like to say that Monica is so right, that listening has to be the first step in anything we do, that these efforts need to come from the ground up, and we just make them come alive. But so we have, this started pre-COVID. We recently launched 2 40-foot trailers, custom-built trailers that are mobile grocery stores, client choice pantries, if you will, full of lean proteins and fresh fruits and vegetables and dairy and some non-food items that are integral to people's health. And we are taking them to these very significant food deserts that we have here in Duval County. And people will be able to shop. They will receive nutritional education. They will learn how to make those baby steps that Monica referred to. We have a registered dietitian on staff that I've known for many years. And that's always been our premise, is you can't change somebody overnight, but you can change them with tiny baby steps. And so that's an issue for us. Understanding that these communities have suffered these health disparities in such a significant way that's really been brought to light by COVID, I think might give us an opportunity to educate in a way that we might not have had before, because people have seen neighbors and friends and family members suffer so significantly from COVID. that we are also launching a prescriptive nutrition program, working with our free and charitable clinics and our federally qualified health centers here, so that those primary care providers who are providing a medical home can write a prescription that can be filled in any one of our locations, whether it be through our mobile units or through pantry operations where they're trained to distribute food based on a nutritional, whatever disease somebody is suffering from. So, those are just some of the things that we're trying to do, which, kind of flies in the face of how we are having to operate during COVID, because it's always a low touch, no touch model that we're aiming for. That box of shelf stable food and a bag of produce is not necessarily the personal way that we would like to be assisting, but we do right now have to feed so many people. So a combination of these efforts till we come out of COVID, I think is kind of the best we can hope for right now.
Definitely. I would say from a department standpoint, and I'll continue to really press on it, is the fact that, a lot of what we do depends on partnerships. And as we look to, what COVID-19 is going to look like as we head into 2021, understanding that at this point, there really isn't a clear light at the end of the tunnel. We're continuing to really build on our local efforts to organize around organizations that have these innovative solutions or that are expressing to us the needs that they have, so that we can connect them to the resources that we know are available. I think education is a very important part of how we can get to a more food secure state. A lot of times individuals don't understand that these resources are actually available to them. They might be living, right down the street from a pantry or right down the street from a feeding organization, and they just don't happen to have the resources. So I think more education and a lot more awareness initiatives around why it's important to have nutritious meals and why it's also important to have food access, and getting a lot of our local leaders, including, nonprofit, private, and elected officials, all to the table to have these conversations. Because, one thing about not just COVID, but food insecurity in general is you can't operate in silos and expect for there to be some type of, massive change, even in the light of COVID-19, and understanding that there's been more light shine on the disparities that exist. We have to continue to be vigilant, and we have to continue to bring these leaders together to the table, so that our community members can understand what resources are out there, and so that we can work on a more interconnected platform. From our perspective, we're going to continue to find and work with organizations that are creating these innovative solutions, to highlight them, to make sure that folks are more aware of them, to make sure that whatever we can do, whatever resources we can provide, whether that's connecting them to our regional food bank partners, if they want to be a part of our emergency food program, understanding that these localized solutions and localized efforts are really what's going to be needed in order for us to move the needle forward. And we can't always look at it from a 30,000-foot view.
And one of the things that, before we jump in, if there are any other right now solutions, I want to say something that's key. One of my colleagues at Edward Waters College, Dr. Jackie Connolly, said something that was simple: all this affects mental health. And I think, Jackie, that's a really great sentiment, because when we see people that can't afford or can't get to the food to feed their families, and they look around, you can't go outside, you don't want to have contact with people, you can't go to funerals or weddings or anything like that. COVID continues. And that's one thing that I think we missed the mark on. So thank you, Jackie, for bringing that in. Mental health is just as important. Brian, Monica, any thoughts of right now things?
Yeah, so I'd like to just mention a little bit. So kind of coming off of Mikhail's comment about partnerships. So at Mayo Clinic, we've developed this Wellness RX initiative that has been in existence for about 4 years. And the important, I guess the thing that makes it the most important is that it really is a partnership between Mayo Clinic, community-based and faith-based organizations, and residents of the communities that we serve. And one thing that we've seen is that by addressing food insecurity. So yes, we're in communities that are food insecure, but we are also providing education and information about diseases. We pivoted a little bit to where we changed our drive-through, our food model to a drive-through and created safe practices. But it wasn't just about giving food. We gave education and information and had safe, socially distanced conversations with community members. But I think that the key that's what's going to make this successful is what we're working on now, which is sustainability. So we have built a model, but we're working with community members within the neighborhood and really working with them, teaching them how the program was built. How do we do what we do? How do you operationalize it? Because I think that when we think about sustainable models, it has to be models that the community leads and owns, and that essentially we work ourselves out of a job. That if we're able to teach community members, this is how we have developed it, and feel free for community members to feel free to develop the model that they want or that works best for them, it becomes sustainable because now it's no longer relied solely upon organizations such as Mayo or organizations, such as our community-based or community-based partners.
One of the things, Monica, I want to share is Mia Habdi just commented. It's a pretty lengthy comment, so I don't want to put it up to block too much of the screen. But she says she's been working with Mayo for several years to address the wellness needs of the Newtown community with the American Heart Association and many others. And there are lots of great initiatives already going on. And I think one of the things that Mia is saying, which is important, we don't need another program. Let's strengthen the programs that we already have right here on this screen with us five and the other people that are standing around and the state representative, others that are around. We've got programs. We've just got to get to work in those programs and making them work. Stephanie Campbell commented, Dr. Stephanie Campbell, that some of these issues affect crime as well, right? People just want access and opportunity. Let me, I kind of want to pivot just a bit. There's increased spotlight because of the George Floyd situation and Breonna Taylor and so many of the other situations that we see, Ahmaud Arbery, with race. The disparities are being highlighted, not only in that particular thing that's going on, but also in people understanding insensitivities. I talked to a buddy the other day who is a student. I'm a graduate student myself, and one of the teachers brought up being the black sheep of the family and apologized later after class and said, hey, I didn't think about what I said. People are just more sensitive now. And whether or not, it's something that we pay attention to, it's a good thing because it starts conversations that haven't been happening before. One of the things that we know, again, I gave the statistics, communities of color, more disproportionately affected. When we look at this increased spotlight, how can it be leveraged? The spotlight we see on communities of color now, what can these communities do as a whole to leverage that spotlight so that things can change on a sustainable level?
Well, I'll go ahead and start first. And this isn't necessarily from a department perspective, but just in general, when we talk about communities of color, obviously there have been a lot of disparities that these communities have had to go through over the years. And it's not something that's necessarily just come into light, right? It's come up in instances, not just this year, but previously. And so I think it's going to be really important for organizations, especially, advocacy organizations that really, I guess, foundationally support and are trying to improve these inequities to take advantage of it and really put pressure on our elected officials and put pressure on our community leaders to not just do performative action. I think when everything first started and, with George Floyd and some of the other issues that came up and, Black Lives Matter started to speak out a lot more earlier this year, we saw a lot of bigger companies coming forward and saying, that they were going to dedicate X amount of dollars to Black community issues and they were going to do this, or they were making these statements of support. But I think it's also important for us to make sure that we're following up with these organizations and that it's not just performative. And what I mean by performative is making a statement that doesn't actually have any follow through, or pledging to create a committee that essentially ends up having an internal committee with folks that are in that organization and aren't taking the steps to actually reach out to these communities that are being affected. And so I think it's going to be important for those communities to step up and really engage and hold folks accountable. So it's like, if you said that you were going to dedicate X amount of dollars to this particular initiative, how do we follow up with them to make sure that those dollars are being spent that way? If they're saying they're going to create a committee around, social justice and, more access and more equity, who's on those committees? Can we see who's on those committees? What are you all actually doing to show us that you want our voices to be a part of those conversations? Because it's very easy for folks to get caught up in the rapture and say, hey, well, we support this, because they don't want to be, out of that conversation as someone that didn't speak out. But it's also very important to be realistic and also work with those communities that are having these issues. And it's going to be very important for, like I said, the leaders of those communities to stand up and hold folks accountable. And that'll be the first step to really getting towards real change.
Any others on leveraging the spotlight that is increased right now? Anybody else?
I agree. So I think that what's going to be important for our community is really working together to come up with a plan. So, as Mikkel mentioned, there are lots of organizations who have pledged, money to, address inequities, to address racism. And oftentimes some of these organizations are really looking for the answers because, as Mikkel said, they may not, their committees that are being built may be of internal employees. And so they may not have the answers. So I think that it's important for, now that the spotlight is on the injustices that have been there for years, but now that we have the spotlight, I think it's important that we, really develop a plan and work with these advocacy groups in our communities to write that plan down. And as Mikkel said, keeping these organizations accountable, because next year it may be something different and the spotlight may be off, but we have to be able to hold these organizations accountable. So I definitely think having a plan and mobilizing is key.
Right. And I would say, yes, let me add to that. I would say that we need to, get in contact with, organizations like the teachers union, labor unions, and so on, so that we could actually start to educate the people about the virus. We got to start educating the people about the vaccination. We got to start to educate the people about the flu, because with the flu and the COVID together, it would exacerbate this response. And as you know, we are the most vulnerable in our community. And so we actually need to bring more awareness by seeking out additional organization for help in solving this problem.
Absolutely. One thing I was going to mention, one of the comments that came from YouTube, Susan, this is Kimberly Mariani, who says there was an interesting challenge that came about. Your predecessor did something encouraging people and partners to skip a couple meals. And this person, Kimberly, said, everything's more challenging when you have not eaten that day. Your ability to parent, your mood, try it. And so I know that's something that I thought that was an interesting comment for maybe people who don't really understand how hard it is. Put yourself in the place of the other person.
Absolutely. I mean, it's a great idea. It's been practiced a lot, and it's so telling. We just, we don't know what that feels like until we try it. And there's a certain fear that comes from that, not knowing where the next meal could come from. And that's the reality for more than 300 and almost 50,000 people in our community, is that you don't know if you're going to have that next meal.
Right, but also the problem that we have in our communities also is unhealthy eating. We're stuck in a community with no proper grocery store. We were bred that way, to just go to the food place and to eat. So we're eating high sodium diet, we're eating high sugar diet, and this is what's bringing on the problem that we have in our community. Is because of lack of proper eating habits. And they have actually done a study in Pennsylvania where they actually brought in supermarkets into the community. And when they brought it in, the people continued to eat unhealthy because that's what they're accustomed to. That was their taste bud. And, this is a problem. So that's why it all revolves around education. We got to educate the people.
Definitely. And just a piggyback on that, Smalley, I think that couldn't be stated more More so, we really do have to educate folks, because when you think about culture and you think about the way certain communities were raised and the way certain people were raised, you have parents that were raised in households where nutrition was not a topic of conversation. You have cultural eating habits that are stem from years and years of, inaccess, right? So to think that, if you bring more access or providing food, that's not the silver bullet. We really have to educate families on how important nutrition is. And we have to also, try to invoke that behavior change, because you can have a grocery store in a community and people will still go and buy unhealthy foods if they don't understand how that unhealthy food impacts their health, how it's going to impact their child's health, how it's going to impact their child's trajectory and their ability to understand and to be better educated and to have, the resources mentally that they need to sustain. So, education and nutrition education is extremely important. And one of the things that our department has always been an advocate for is providing resources. And, whether it's a school setting or a nonprofit organization or faith-based entities, they can get in touch with our department, and we have tools. We have curriculums that help people better understand why nutrition is important. We have curriculum that students can have, or that teachers can incorporate for their students to have, to better understand these things. And it really has to be that affirmation on both the student and parent side in order to invoke those behavior change that we want to see. Otherwise, it'll just continue to be an issue that goes on, even in places where access might be improved.
I see another comment that is coming from YouTube. Jackie Slater says, one of the issues is that with people who are English as a second language, that's something we don't think about. I know when I got Paul's email about doing this, one of the cool things I thought is that, of course, it's Humana. You're dealing with a lot of different people, a lot of different places. But Paul's email came to me, and I greeted everybody when I came into this thing in Creole, in Spanish, and in English. Why? Because they're people who have that's something, as you just said, Mikhail, you've got to reach people wherever they are. And so we've got to find ways that we can consistently allow them to share that and start a culture, as you said, Dr. Seymour, earlier, a culture of maybe not doing what we always did. I remember a guy, Bernard Gregory here, local guy, who said, if you've done what you always did, you'll get what you always got. And that was a pretty sage piece of advice, because I want something different. I want better. And I'm sure you as well. As we look into these other specific issues in communities of color about the organizations that are already doing things, how can we pivot them? I know one of them is like Richard Danford in the Urban League. That comes top of mind. Richard in the Urban League bought some property on Myrtle Avenue, I believe, near EWC. How can we pivot the communities that are or these organizations that are doing things in the community, like this new center they're proposing or other places, to find ways to put in some kind of portion of whatever they're doing to focus on these kind of food insecurities? Because sometimes maybe they're, I know the thing, and I don't know all the funding parts of it, but I know the thing with the Urban League is more geared toward veterans. But it's something that's necessary in the entire community. How do we help them to pivot? And thanks, Jackie, for that comment, by the way.
But Feeding Northeast Florida, we are at our heart a distribution and logistics business. We are in the business of moving food, excess food, from where it is to where it needs to go. And so I think this speaks to the essential nature of collaboration and to working through whatever local groups are working there to make sure that food is a piece of everybody's life every day. And if we can provide that food in conjunction with whatever other services they are looking to provide, we are just empowering communities and giving them the opportunity to be healthier. I'd like to just back up a tiny bit. When we were talking about access is not the only thing. I used to run a large agency partner here in Jacksonville. One of the things that we saw so consistently from direct client contact is that people generationally do not know how to cook. So providing them with beautiful fresh produce or things that they're not accustomed to doesn't necessarily serve them well. We have to start teaching people how to cook in a healthy way, how to cook at all. And so these are all opportunities. And I suggest that, when something like the Urban League is looking to do a project, that the food bank needs to be a partner in that. And how can we help you help in whatever efforts? you are trying to do.
We're going to make sure we make that connection and collaboration, because it's right there in our community. And it could be, even if it's just a corner, that whole pop-up shop is just a thing that, let's have pop-up fruit and vegetable spots, and even working out, like, pop-up trainers come in and do it right now. One of the things that I was most passionate about with Edward Waters College, our new Knack Lover Field that's coming up. It's a place for the community to go and work out. There may not be a gym, but at least they can get out there and run and have those activities. So, but access is important. As we wind down, because we only have a limited amount of time, and I'm so thankful for all of you that have come in with your comments, your ideas. And there are a few other things. There's a comment that just came in, the Boys and Girls Club. I didn't know this, and maybe you did. The Boys and Girls Club of Northeast Florida has a mobile veggie bus. The mobile veggie bus goes out to the site. That's an innovative idea. Thank you, Angela Rim, for bringing that in. Angela said they're open for communicating with other community organizations. Within 30 days, they're going to take SNAP. Something you said, Mikhail, earlier. I think you talked about SNAP. They're going to take SNAP within 30 days. The Boys and Girls Club's doing that. So it's non-traditional organization doing things in non-traditional ways to help traditional people stay healthy. And that's, I guess, the probably easy way to sum it up. Speaking of summing it up, though, we are heading to the end of our time. If there's like a final thought that you can give, what do we need to do as a community? What do people need to do to pull together so that as we are experiencing COVID-19, we don't know when this is going to end? I just got an email. I was supposed to do some travel out of the state early next year, and everything is still canceled. Nothing's going to happen until the end of next year. I'm getting emails and speaking engagements. All these things are being postponed. COVID-19 is probably going to be with us for a while. Leave your final thoughts. Next steps. What do we need to do, and how can we empower ourselves, our companies, and the communities that we serve to be better and work together so that we can still be alive on the other side of this?
So I'll start. So I think first is we have to get comfortable with coming out of our silo and collaborating. So, these types of programs and initiatives are much stronger when there are multiple partners at the table and not just one partner that's wanting to lead and take it forward. So I think that that's something as a community that we have to get comfortable in doing, is really collaborating. And then I would also say engaging each other, engaging those that are impacted by, and it's really all of us, but those that are living in these food deserts. So engaging those residents and making sure that they are a part of the conversation, because we never want to feel like we're doing something for people. We're trying to tackle this together. So I definitely think that those are a couple of things that we can do now as we navigate through COVID-19 and the uncertain future.
Yeah, I'm going to say that obesity is a form of malnutrition in our community, and we have to start working on eradicating it from our community. And the way we got to do it is we got to continue with our education. We have to form groups. We have to form community groups. We have to educate each other, and the ones that have the right education have to be involved and to work with the people to educate. We have to continue with our tobacco cessation programs, because even with COVID, the smoking tobacco actually increases the ACE2 receptor that gets into, that's in our respiratory tract that the virus attaches to, and it actually amplifies. And this is why people, like smokers and so on, would end up in a situation worse with respect to one that is in better health. So we have to educate our community about these things. We have to educate them about the virus. We got to educate them about having taken the flu shot, because we got to let them know that if you come down with the flu, you come down with COVID, it exacerbates the response, the inflammatory response. It exacerbates that cytokine storm that Fauci talks about, and it's going to be detrimental to us. So we got to continue with education in our community, in this community. Thank you.
Thank you.
One thing that I'll say, obviously COVID-19 has had a lot of negative impacts, right? And it's really been a lot of challenges around the pandemic and issues, but there are also some silver linings that we have to understand. For instance, the fact that we're on this virtual platform today, right? And, Dr. Johnson has said there might be, hundreds of folks that are tuning in right now to get this information. And so what that lets us know is that we have to be willing to use the platforms and the access that we now have that, our society has shifted to get more people in tune with what's going on within this food access space. I think local communities, it's really important to engage with your local food policy councils, right? If you're an organization that's represented a underserved community or underserved group, what is it that you're doing in your community to identify those people that are supposed to be addressing food access issues? And food policy councils are a great place to start. There's a Florida statewide food policy council that talks monthly on issues related to food access. They bring people on every month that talk about different ways that individuals can gain access to foods on a local level. They talk about opportunities for innovation and ideas that could really stimulate changes in these communities. And I think it's really going to be important for those folks that are dealing with the issue to break out of those traditional, oh, well, I don't know where to go, and really start to utilize the tools that are out there, because now there's a lot more access to information, a lot more of these conferences. You don't have to drive to them anymore. You can actually stream it on your computer or stream it on your cell phone. So the access to the information is out there. It's just going to be more important for those groups to start to collaborate with entities like your local food bank, or make that connection to reach out to the Florida Department of Agriculture to see what type of programs do we have that might be a good fit for your community organization. And if it's not through us, what resources do we have to connect you with a partner that we might have within that community that can help you address those issues that you're trying to accomplish. And so collaboration is definitely the most important thing. Public, private, and a nonprofit sector are going to really have to come together and not try to do it on the fact of who can be the most impactful in this space, right? Who's going to be the leader in this space on food access? I think we really need to get that idea of championing something and being that entity that's known for it, and just say, hey, how do we just make this better? How can we work with other healthcare companies? If we're a Humana, how can we work with Florida Blue? How can we work with Advent Health to come together with more centralized ideas for collaboration, as opposed to us feeling like we're competing, or we want to be the one that's known for championing this issue to the public. I think that's what's going to be important as well, for folks to really come together, sit down, and for these communities to get that fire to step up to the plate and go spearhead some of these initiatives and hold the folks like their local elected officials, especially after this election. We've seen that, if you go out and voice your opinion, change can be made. And that's been evident from a national election, and can be the same thing on local elections as well. So engaging with your political process is extremely important. And also just identifying the resources and not being stuck in that, what do I do phase.
Well, if I could follow up really quickly, I know we're about out of time. I want to kind of follow Mikhail's point there that we really have to educate ourselves, and we then turn around and advocate for healthier choices for communities that have really the disparities that have come to light here. But one of the things that is unique about this moment in time is that, for example, as a food bank, we've had an enormous number of people who have recognized that hunger is absolutely unacceptable in our community, who never necessarily knew on hunger as an issue or food access as an issue. So we have this extraordinary opportunity, while people are really listening, to bring to the forefront the idea that hunger is a solvable issue, that food access is something that we can focus on, and that we need to educate and advocate.
Absolutely.
Thank you, Susan. And thank you to all of our panelists who are here with us. We appreciate you, Mikhail, Monica, Brian, Susan. You are, for taking the time out of your day. You are amazing. And there have been such great comments. Before we kick it over to wind things up, I want to do a piece of breaking news and then a couple of the comments. This just in, speaking of COVID-19, and I'm a news guy. That's what I did for years. So, of course, if breaking news comes in, I'm going to tell you what it is. About 30 minutes ago, current Secretary of Housing and Urban Development, Ben Carson, just tested positive for the coronavirus, according to his chief of staff. I bring that up, although it is a piece of breaking news, because as we saw, the President of the United States, other leaders of world leaders who were insulated, were positive for the coronavirus. So I bring that up because if these people can get it, anybody can get it. So please make sure that you're being safe, that you're wearing masks, that you're washing your hands, but that you're preventing a more catastrophic illness by nutritionally being as sound as possible. The other thing is I want to bring in some of the comments that were shared as I bring this to a close. One of the comments, Mia Habdi, the pink elephant in the room, is that many Black communities around the country have issues with trust. So Mia, thanks for bringing that up. That's important. Kim Davis said both panels expressed the importance and collaboration of education. That's true. Everybody talked about collaborations. I'll be putting up a graphic in just moments that has a lot of our numbers, contact details. So reach out to us. Edward Waters, as an academic community, I know I've gotten some text messages, some inboxes and DMs. Keep them coming. All of our addresses are up on this slide. Reach out to us. Let's talk, because at least this conversation gets it started. We're going to walk away from here being able to collaborate, and that's more than we were able to do when it started. Finally, Dr. Madastin, thank you for watching and being a part of this. We appreciate your comments. And now, our co-sponsor for this event, Paul, I believe you are here with us, and if you could wind us up, and we'll be out in just moments. Paul?
Thank you, Rahman, and thank you to all the panelists. I really appreciate this. You know, we did get a lot of information, a lot of great collaborations going on, and some innovative solutions that have come out of this crisis. So I'm really excited about where we are and continuing this conversation. I think a lot of our panelists talk about health being local, right, and the issues being local. And so that's working with the influencers, the trusted people within those communities to understand the specific challenges and how do we create and co-create sustainable, lasting change in these areas. A lot of these issues have been going on for entirely too long. And so, you know, I'm happy as part of the Bold Goal and part of this collaboration and to see the speakers to be a part of this. And I don't want today to be the end of the conversation. I want it to be the beginning of the next step that leads to major change here in Jacksonville and across the state and across the country for that matter. So thank you everybody for joining today. Thank you for being partners with the Bold Goal. Thank you to our panelists, and especially Rahman, thank you for all your hard work. I know I wanted to take a lot of this on, and you did a great job of putting this together. So thank you, everybody, and enjoy the rest of your week.
Humana has a bold goal: to improve the health of the communities we serve by making it easier for people to achieve their best health. For the last several years, we have been working with community partners and physician practices to co-create solutions at a local level. Together, we are tackling chronic conditions and social determinants of health, such as loneliness, social isolation, and food insecurity, those barriers upstream from our traditional healthcare system. Why? Because good health is hard, and we cannot do this work alone. We are still learning. Help us move the needle on population health and be a part of something bold. Visit humana.com/bold goal for more information.